Hello, everyone. I'm Amy LaValle, and welcome to the Brian Grant Foundation monthly webcast. As many of you out there with Parkinson's know, one of the most challenging symptoms is constipation. It can be a pain in the rear. We're taking a different approach to this topic today. Did you know that exercise routine and even positioning on the toilet can get things moving? We're going to explore non-pharmaceutical options with a physical therapist and a dietitian. They can assist in making adjustments to your daily routines to help get to the bottom of this. I couldn't resist the puns today. Before I introduce our guests, I would like to invite you to put your questions into the chat box below, and we'll do our best to get to them. I would also like to mention that we're discussing non-pharmaceutical treatments. So if you have any questions about medications or supplements, please refer them to your physician. Now I'd like to welcome Sandy Gallagher, a pelvic health physical therapist with 38 years of experience and 25 years of pelvic health experience. She works with adults and children with bowel, bladder, and pelvic pain problems. She uses exercise, manual therapy, biofeedback, and self-care training with many of her patients. I would like to welcome back Jelena Vitomovich, a registered dietitian specializing in providing comprehensive support for individuals living with Parkinson's. Her journey into this specialized field began during her college years when her father was diagnosed with Parkinson's, marking the onset of her role as his primary caregiver. Jelena extends her expertise to private clients dealing with Parkinson's, guiding them towards improved quality of life and empowering them to overcome obstacles with healthy eating. Now I'd like to welcome Jelena. We're going to start with you in looking at constipation from the point of view of a dietitian. So I'm going to let it roll.
Okay, thank you so much for that introduction, Sandy. So this is Nutrition Implications for Managing Constipation, advice from a registered dietitian, myself, Jelena Adamovich. And I'd like to start out with this statistic, and that is, did you know that constipation is one of the most frequent non-motor symptoms and affects more than 80% of Parkinson's disease patients? So I just want you guys to know that you are not alone in dealing with this symptom. And the good news is I'm here to help. So as we mentioned, I'm a registered dietitian. I have a master's of science in nutritional science, and I specialize in helping people living with Parkinson's overcome challenges such as constipation. And where my passion and experience really started is with my father, who was diagnosed with Parkinson's disease and who has dealt with probably some of the most extreme cases of constipation. I'm talking cases that led to hospitalization. So it really, my experience with my dad really helped put into perspective just how serious constipation can impact a person living with Parkinson's life. And I want to get into how nutrition plays such an important role in digestive health and managing constipation. So you've probably heard a lot about fiber, but I want to explain a little bit more about why fiber is so important and how it helps with digestion and constipation. So dietary fiber is a type of carbohydrate that your body cannot fully digest. Instead, it passes relatively intact through your GI tract, and it helps prevent constipation by adding bulk to your stool, softening it, and making it easier to pass through your digestive tract. I think it's really important when teaching nutrition concepts to help people understand why fiber is recommended, right? So you can understand the relationship between a certain food and how it affects your health and your body. Fiber also serves as a prebiotic, which is a term that refers to fuel that feeds your good bacteria in your gut. So a lot of the times you'll hear about probiotics, which are the healthy bacteria in our gut. Prebiotics come from fiber, and they're actually the food source for the probiotics in your digestive tract. And why this is so important is because a healthy microflora helps promote healthy digestion. So think of fiber as not only helping form bowel movements and making them softer and easier to pass, but fiber is also an essential nutrient for helping maintain a healthy gut microbiome, which in turn helps improve your digestion. Now, there's two different types of fiber. There's soluble fiber and insoluble fiber. A lot of fiber containing foods contain both types of fiber. Some contain more soluble fiber, others contain more insoluble fiber. But I really want to help distinguish the difference between the two and how each type of fiber can help with constipation. So first we'll start with soluble fiber, and this is a type of fiber that dissolves in water to form a gel-like substance in the digestive tract. And how this works, it increases water retention, which helps soften the stool and make it easier to pass, helping to prevent constipation. So if you're feeling like your stools are really hard and hard to pass, soluble fiber helps increase water to the stool and help soften it. And examples of soluble fiber include foods like oatmeal, beans, dried figs, seeds, citrus fruits, broccoli, Brussels sprouts, just to name a few. And then insoluble fiber does not dissolve in water. Instead, it adds bulk to your stool, which helps move food through the digestive tract more quickly. By speeding up the passage of food through the digestive tract, it helps promote regular bowel movements. So how we thought of soluble fiber is helping to add water to the stool and make it softer and easier to pass. Insoluble fiber adds bulk, which makes the stool a little heavier so that it can move through the digestive tract quicker. Examples of insoluble fiber would be like whole wheat products, whole grains, dark leafy vegetables, prunes, berries, and you need both types of fiber. It's just important to understand how each type of fiber affects bowel regularity. So how do you get enough fiber? Most Americans do not get enough fiber. That is a fact. Adults need 25 to 30 grams of dietary fiber daily. When I talk to people, a lot of the times they'll say that they're eating enough fiber, but then when I really look at their nutrition from dietary recalls, it's not uncommon to find that they're not eating enough fiber. So I want to encourage you to check the nutrition facts label, which you can find on the back of food products, and look for the dietary fiber content on certain food products. So if you're buying like cereals, crackers, granola bars, cans of beans, whatever food product that has a nutrition facts label printed on the back, I want you to get in the habit of checking the dietary fiber content, which is always printed on the nutrition facts label. Another tip for increasing fiber intake would be to choose whole grains over refined grains. So whole grains are going to be foods like brown rice, whole wheat bread, whole wheat pasta, and you're going to want to choose those over refined grains. Refined grains are white rice, white bread, white pasta. Those refined grains have little to no fiber in them. You're going to want to eat more beans and legumes. So add beans to salads, to soup. Sometimes people will substitute meat in recipes for beans. Like for myself, I like to make tacos with lentils. They're also a good source of protein, so I feel like it's a pretty fair substitution for meat. Add a serving of fruits and vegetables to meals and snacks. Add nuts and seeds to meals and snacks. So you could add nuts to salads, to yogurt parfaits. You could add seeds like flax seeds and chia seeds to your oatmeal or smoothies. Add fruit to dessert and baked goods. So any excuse to eat dessert and baked goods, you can add some fruits to it. Like if you want to make a fruit cobbler or add some fruit when you're having any ice cream or cake, just to increase the fiber content. And then order veggies as a side dish when eating out. So if you're going to a restaurant and you're choosing sides and they have a vegetable as a side option, it'd be great if you could choose that. And now we'll get into another important topic, which is hydration. So let me tell you a little bit about how hydration helps prevent constipation. So water is retained in the colon, which helps soften stool and prevent it from becoming dry and hard, which makes it easier to pass. Water helps lubricate the digestive tract, making it easier for food and waste to move through the intestines. And water is essential for proper muscle function and helps maintain smooth muscle contractions that move food waste through the digestive tract. Water and fiber go hand in hand, for example, if you're eating a lot of fiber, but you're not drinking enough water, you're not really going to reap the benefits of the fiber helping you with digestion. In fact, the fiber might constipate you if you're not having enough fluids along with it. So that's a very, very important thing for people to understand, is that the fiber and hydration go hand in hand in helping relieve constipation. So often I get asked, how much fluid do I need? This is a very general calculation that we use. So the general recommendation is 25 milliliters of fluid per kilogram of body weight. So I gave a little example for how you guys can figure this out, and you will receive a copy of these slides. So don't feel the urgency to have to write down this equation. You can review it later. Essentially, you're going to take your weight in kilograms and multiply it by 25 milliliters. And this is going to give you the amount in milliliters of fluid daily, which you can convert to liters because liters is a little bit easier to conceptualize. And then just to note that this is a very general recommendation. Certain health conditions such as kidney disease, liver disease, heart failure may require less fluids. So it's really important for you to speak to your physician if you have any of those underlying conditions to see if you have a special fluid requirement. Now, here's some tips for staying hydrated. What I find extremely useful for myself, and I actually have it right next to me, is to carry a refillable water bottle with you wherever you go. So for me, I fill this water bottle up at the beginning of each day and have it with me everywhere I go. At work, it's sitting next to me on my desk. In my car, it's sitting in my cup holder. At the gym, it's with me. So it's a reminder to always drink water, but also it helps me track how much water I've had for the day. So let's say I pick this up in the middle of the day and it still feels pretty heavy. That's an indication to myself that I haven't really been drinking enough water. But let's say by the end of the day, it's completely empty. That helps let me know, like, okay, I drank at least a decent amount of water today. So you're going to want to keep water visible by having it on your table, desk, nightstand. If you don't like the taste of water, you can try flavoring it by adding citrus fruits, cucumber, and mint. You could also get fluids, not just from water, but also by eating water-rich foods like watermelon, cucumbers, lettuce, celery. And for additional hydration, you can drink electrolytes, which you can get from coconut water, sports drinks, or by using electrolyte packets and tablets. And now we're going to get into our last topic about what can help with constipation, and that is magnesium. So how can magnesium help alleviate constipation? Well, magnesium is a mineral that plays a crucial role in muscle function, including the muscles of the digestive tract. It works by relaxing muscles in the intestines, which can promote bowel movements, and it has an osmotic effect in the intestines, meaning that it draws water into the colon, and this increased water content to the colon helps soften the stool and make it easier to pass. So all of these things are kind of related, right? The fiber helps draw water into the colon. You need the water from somewhere, so you're going to stay hydrated to provide your body with that water that it needs. And then the magnesium also has that osmotic effect to help draw water into the intestines, which soften the stool and makes it easier to pass. So all of those things are interrelated in helping you with bowel regularity. So for magnesium intakes and food sources, the recommended daily allowance for adults who are 31 years or older, males, it's 420 milligrams a day, and females, it's 320 milligrams a day. I've provided some food sources for you guys to refer to. So dark leafy greens such as spinach, kale, Swiss chard, collard greens, nuts and seeds such as almonds, cashews, Brazil nuts, pumpkin seeds, whole grains, brown rice, quinoa, whole wheat. So a lot of those foods also have fiber. So if you wanted to incorporate those for the purpose of increasing your fiber and magnesium intake, you're like killing two birds with one stone. Also fatty fish like salmon, mackerel, and halibut, avocados, dark chocolate, and bananas. I've said this in previous presentations. I'll say it again. I have a sweet tooth, so any excuse to eat sweets, I'm giving you one, and that is to eat more dark chocolate because it has lots of magnesium. And as far as these recommended dietary allowances that I've provided, if you don't really eat enough of these foods and you're interested in taking supplements, you can kind of use these amounts on this table as a guide for choosing how many milligrams to look for in supplements. But as always with supplements, you always want to consult your physician or a registered dietitian just to make sure the supplement is necessary for your individual needs, and just to make sure that it doesn't contraindicate with anything else that you're taking or any other medical condition that you have. And for my last slide, I wanted to give you guys the opportunity to get some more information from me. So I've created a free guide on managing constipation. It contains more in-depth information on the topics that I presented today, as well as other topics like the importance of movement and stress reduction for alleviating constipation. And how you can access this guide is you can either visit this link, which maybe somebody can help put this in the chat, or I can put it in the chat later. Oopsie. Or I can put this link in the chat later. Or if you want to just take your smartphone and open up the camera app, you can scan this QR code that's displayed here, and that will also lead you to being able to download this free guide. But I wanted to give you guys the opportunity to just get more information from me. So feel free to visit these links to get more access to nutrition information for constipation. And that's the end of my presentation. Just to kind of summarize, the three components we discussed were fiber intake being adequate. Remember that adults need between 25 to 30 grams of fiber per day. And I gave you some tips on how to increase fiber intake. The next topic we talked about was the importance for hydration. And remember that hydration and fiber go hand in hand. So if you're going to be eating a lot of fiber, you absolutely need to be drinking adequate fluids. I gave you an equation for how to calculate your fluid needs, as well as tips for increasing your fluid intakes. And then the last topic was magnesium, and I gave you some resources on the recommended dietary allowances if you're looking for a magnesium supplement, as well as different food sources of magnesium. And that concludes my part of the presentation. I'm going to now hand it over to Sandy.
Hi, everyone. I am going to share my screen so we can kind of um, build on what Jelena, you see that, correct? Amy?
Yes.
Okay.
Yes, we see it.
Okay. So we're gonna, it's such a pleasure to hear Jelena speak. And, I saw her slides ahead of time and have heard her speak in other occasions. So just really getting into all that all that's required with healthy nutrition, which can help so many people. I am going to approach this with a very physical therapist lens and even toward a pelvic health physical therapist lens. So a pelvic health physical therapist, our primary considerations are bowel and bladder function that can include constipation and sometimes helping if people have leakage of stool. It can include difficulty with urinating or leakage with urination. We're going to touch on urination a little bit today just because of how it can affect sleep and how getting a good night's sleep and having a low stress in your life can allow your digestive system to work better. We're going to talk specifically about some exercises, maybe for people who aren't as active as they want to be or as they were in the past. And we know that people with Parkinson's disease, that can be an effect of the Parkinson's disease. We'll talk about bowel massage, some simple strategies, and then just ways that positioning on the toilet might help the skeletal muscles of the pelvic floor pass stool. So we talked a little bit about slow colonic transit. So that's the autonomic nervous system affects digestion. So it's involuntary. And I have here two little stools kind of passing through the digestive tract. You can see the one on the left passes, and most times stool moves through the colon within 24 to 72 hours. Slow colonic transit is when it takes greater than that time. And the longer the stool is in the colon, even with the advice from the dietitian, the more water that is absorbed from the stool and the firmer the stool becomes. And so with physical therapy, one of the things we are trying to guide is to reduce the time that the stool is in the colon. It's going to seem odd, but I'm starting my part of the presentation in the evening and some habits to do in the evening. So Jelena talked about maybe how you could eat through the day and how to get all that healthy fiber and fluid throughout the day. But we're going to start with ways to make sleep better, then get into that movement and massage, and really where a morning meal can affect that morning bowel movement, which is commonly when people have a bowel movement, and then positioning. So generally, reducing your fluid intake about 3 hours before bedtime is going to decrease the number of times, or if at all, you have to wake in the night to urinate. So you'll get more consistent and restful sleep. So maybe consider the volumes of fluid that Jelena talked about and work them into those waking hours and work them in from your 7 a.m. to 7 p.m. But just reduce or eliminate, and particularly things like coffee, before going to bed. And again, your body will make less urine. Additionally, something to consider, so as we are up during the day, fluid tends to pool in the legs. So the purpose of this very simple exercises I'm talking about is to move that fluid that's pooled into the legs into the general circulation so it can be made into urine and you can urinate before going to bed. There are some additional benefits of doing these exercises, of mobility to the hips and legs, and improve bed mobility skills. But as I am talking about these exercises, it's really about the timing of them. So it may be things like lying on your back, and even lying on your back with your feet slightly elevated to bias the return of fluid toward the heart and toward the kidneys. They can be a straight leg raise, a quad set, which is just tensing the muscles in your thigh, ankle pumps, a heel slide, which is just bending your knee, bridging, lifting your bottom up, and then lower trunk rotation. So spending about 20 to 30 minutes in that kind of window of time before bed to get that fluid into the general circulation. Then before bed, make sure to visit the bathroom to urinate, and this is all toward the goal of improving your sleep. Some additional ways to improve your sleep: don't have a television in the room, be off your phone, maybe reading a book or a magazine, or if you have an electronic reading device, do it in such a way that the light isn't keeping you awake. And hopefully in this way, you'll have very restorative sleep, perhaps only wake once or twice to use the toilet to urinate, which is an acceptable number of times for somebody who is 65 or older. Now we're moving to the morning, and perhaps you wake, everyone's going to have a different schedule. So we're saying okay, you're waking 6 a.m., 7 a.m., 8 a.m. And if necessary, if you need to get up and use the toilet to urinate, that is great. But if you don't have that need, upon waking is a great time to do the bowel massage. Now there are going to be those evening exercises really need to be in the evening. As I'm talking about these bowel massage exercises and some other exercises to help move stool through the colon by using your musculoskeletal system, I'm going to discuss optimal times, but really any time throughout the day could be helpful. So with the bowel massage, there are many different versions of bowel massage. I am going to show you what I typically have people do. And the timeline is really that you're spending about 10 or 15 minutes in this morning doing stimulation on the abdominal muscle wall to help facilitate what we call peristalsis, so that motion of the colon to move fecal contents through itself. I oftentimes have people start just simply by putting their hands on their sigmoid colon, and that's the left lower quadrant, and supporting it in that area. And then move on to some gentle stroking along the left lower quadrant, along the sigmoid colon, adding in the descending colon and transverse colon, and then progressing to adding the transverse colon, descending colon, sigmoid colon, and then repeating or additionally adding the ascending colon, transverse colon, descending colon, and sigmoid colon. And then the earlier instructions, because you will have this as a handout, you may spend 5 to 10 strokes in each of those 4 kind of different movement strokes that I mentioned. And this slide, in case you couldn't see my cursor, on the right-hand side, it's going to kind of animate in that direction. So starting with the sigmoid colon, that kind of downward and across, and then adding in the descending and sigmoid, downward and across. Then transverse, and that should go across and down. And then the ascending colon, transverse colon, descending colon, and sigmoid colon. While still in bed, this should actually say 30 seconds each here. You can do some exercises like twisting the legs to the right, twisting the legs to the left, bring the right knee to the chest and put it back down, then the left knee to the chest, and then both knees to the chest. And what we're doing, the intent with that exercise, we've talked about smooth muscle and the autonomic nervous system. And that is how the digestive system works independently of our activity. And here I'm talking about using the musculoskeletal system to help change the chamber of the abdominal cavity to assist with the motion of stool. And so here is that sequence again. So about 30 seconds in each position. If you did all of them one time, that would take 2.5 minutes. You could repeat that. So here we're stretching the descending colon on this side, stretching the ascending colon. Again, kind of compressing the ascending colon on the right, and then compressing again here, and then compressing both. If lying in bed, it's too hard to do the exercises, or if a different time of day is a better time of day for you to do the exercises, those same activities could be done in sitting, and this is a way to incorporate it throughout your day. We know that as people get older, they tend to lose the rotation and they're just not moving as much through the core. So these exercises can allow that to happen. So here we can just like bend over to the right side, bend to the left side, twist to the right and twist to the left, and then this forward bend here. And obviously that would be done sitting in a chair. And if any of you have participated in pelvic floor physical therapy already, you might be aware of Kegel contractions, and a Kegel contraction is a contraction of the pelvic floor muscles. You see those red arcs moving upward, and that is illustrating how when we exhale and the diaphragm goes up, the pelvic floor also contracts. And pelvic floor muscle exercises are typically taught to help control urination and defecation and not leak. But as you're doing them, the awareness of the activity in the muscles can help with the awareness toward relaxation. And it can also be helpful to give some additional compression to the abdominal cavity and assist the smooth muscle of the colon in moving stool contents through itself. So through these exercises, which are done not quickly, and with this autonomic nervous system, parasympathetic nervous system, let's stimulate digestion. We're telling the brain that this is going to be an okay time to have a bowel movement and perhaps stimulating some activity in the colon. And then when you eat breakfast and stimulate the gastrocolic reflex, so that chewing in your mouth, the salivary gland activity, the stomach starts moving and the colon starts moving. And so now that smooth muscle activity is going. And so when you sit on the toilet to pass a stool, the rectum and the colon should be more successful in pushing the stool out. As a pelvic floor physical therapist, and if you see a pelvic floor physical therapist, we're very focused on the pelvic floor muscles and getting them to relax or contract and getting the abdominal muscles and pelvic floor muscles to work together. The things that I am talking about now are ways to get those elusive, smooth muscle of the colon to work better for you. In addition, like when you do go to use the toilet for stooling, there is some benefit to using a footstool, so something that supports your feet and gets you in a little bit more of a flexed position, so you have the thighs compressing on the abdominal cavity. It also puts a stretch through the pelvic floor. We do want you to be safe. We do want you to be able to relax on the toilet. So if using something like a squatty potty is not relaxing for you, then it would not be advised. And it doesn't have to be a specific toileting stool. It could be a footstool that you just have near the bathroom and maybe ready to put under your left leg, which is where you might need that compression to assist the sigmoid colon and the rectum in moving the stool out of you. And you just want to be relaxed in as many places as possible, like so thinking about your face and your hands and your breathing. And so those are just some basic things that, through this mechanism of a Zoom webinar, I'm able to pass on some information to you. I'm very active in the pelvic physical therapy community, and something that I get contacted about often is using electrical modalities, things like TENS, muscle stimulation, and interferential current for different pelvic floor conditions. And we mentioned that I see children and adults, and really my interest in that came when I started seeing more children, but there's good data set that it's applicable to multiple conditions. And what I'm going to talk about now are some specific things for people with Parkinson's disease that we have some evidence for, and some things that we have for other conditions. I am not prescribing these things to you. I am not going to give you specific parameters about them, a little bit like Jelena talked about supplements, and Amy mentioned medications. But I want you to know that they exist. So if you are engaged in pelvic floor physical therapy, or if after this today you seek care from a pelvic therapist, and if they're focusing on the activities we usually use, some of the things I talked about, they're teaching you specifically the abdominal massage. They may do something called EMG biofeedback to help you learn how to relax your pelvic floor muscles. Perhaps from here you could query them about some of these other interventions if they're not being used. So those specific things are TENS, which stands for transcutaneous electrical nerve stimulation. For bowel and bladder conditions, it's typically done in two ways. One is sacral nerve stimulation, and the other is tibial nerve stimulation. And then interferential current, which is also done with a small handheld unit, uses more energy. It's a medium frequency current, and you need 2 channels for it to work. So some of the placement options that are done in pelvic conditions could be on the back and the lumbosacral area. They're not puncturing any skin. They're just surface electrodes placed again on the back, perhaps in the suprapubic area, so on the abdomen. And then with the tibial nerve stimulation, they're actually placed on the ankle. And there is evidence for people with Parkinson's disease in the context of urinary urgency and urinary leakage. And there is also evidence in other populations for relieving constipation, but there's not specific constipation and Parkinson's disease evidence. So I just want to be clear about that. Although I have done this with my patients who have Parkinson's disease with good results. A little bit more complicated. So interferential current comes from the word interference. That's where the interferential is. And that means the 2 channels have to cross each other. It has to be 2 channels, it has to be 4 electrodes, and they have to be crossing. The most common way it is studied for slow colonic transit in children and in adults, but not specific to Parkinson's disease at this point, is with electrodes placed on the abdomen at the level of the belly button, and then at a corresponding and opposite place on the low back, and the same thing here. So I think I've emphasized my X enough. It is difficult sometimes for people to put electrodes on their back. And so under guidance from my physical therapy colleagues who do a lot of electrotherapy in their work, I have adapted some of that to do kind of the X crossing on the abdomen. And you can see here that the colon is in the target. So it helps to create that peristaltic action in the colon, it is not done as a one-time treatment. It is something that people do repeatedly. It could be daily or every other day. And in the context of how I provide care, it's having people get an appropriate home unit and use it at home. So I just want you to know that that exists. And I'm not saying that everyone needs it. So simply, kind of a little mnemonic in the sense that all the words sound the same, kind of a summary of both of our talks is this food, mood, and movement. And Jelena and I talked about food and movement, and both of us agree that stress reduction and controlling your mood is also essential for good colonic function and digestive function. And I sometimes will stretch this mnemonic to food, mood, movement, and poop. And so we're going to open it up to questions. And if you are looking for a physical therapist who does women's health or pelvic health, a couple of internet searches could be Find a PT or PT Locator. Thank you.
Great presentations. Thank you, ladies. I've got a list of questions. So everybody out there, if you have any questions, please put them in the chat box, and I will start with a few of mine. One, for the squatty potty stool, is there a height that is preferred, or I'm blanking on the word right now, a good height?
People should be comfortable on the toilet. And so if a person is really tall and they're on a standard size toilet, it might not be necessary because they can get that angle of hip flexion and already have the compression. Sometimes people are using a raised toilet seat because it's easier to get up and down from a higher surface than it is from a lower surface. So if we often see it like if someone's had a hip replacement, they might have a raised toilet seat. And so a raised toilet seat it's great for getting up and down, but it's really bad for pooping. And so then the squatty potty, and I'm not endorsing any one brand, does come in two heights. But the tall squatty potty is for short people because they need a little bit more height to get the thighs up against the belly.
What about, everybody does this, reading on the toilet, playing with your phone on the toilet. You talked about, this whole body. Does that help relax you, or should you be focusing on that process?
So most of my
I can't believe I asked that.
Yeah, most of my opinion about this comes from working with children who are postponing bowel movements so long that then they end up with leakage and constipation. So we wouldn't often describe this, but pooping is a skill, right? And some people are better at it than others. And if someone is having difficulty with pooping, you're having a bowel movement, and their goal is to have better bowel movements, then they should be aware of how it's happening, right? Not just I sat and I set a timer on my phone for 10 minutes, and then I did the Wordle and, connections, and then I turned around and there was poop, and I was like, okay, that was a good one, right? We want to know what was it about how you held yourself on the toilet, or, as a pelvic health physical therapist, I'm always going to these meetings and other therapists will describe this is the way you should poop. Do this with your belly and that with your pelvic floor and this and that. And I'm like, I think everybody, and they'll describe different ways. And so I really do think for learning, people should not be using a phone or reading. And then we're kind of 10 minutes. And if nothing has happened, get up and go away.
Jelena, I was wondering if you could talk about a diet to restore peristalsis, or also kind of how to get through that gastroparesis. Is there anything to help with that?
Yeah, I don't know if I can say that there's a food that specifically restores peristalsis. I think that some of the information that I talked about could be important. So Fiber intakes are going to be really different for people with gastroparesis because gastroparesis is slowing down of the digestion, and fiber can kind of also slow down digestion. So the two don't really go together, and it's really hard for me to give, again, a general recommendation for that. It also depends on how severe the gastroparesis is. For some people, they experience it very, very severely. So that's kind of a hard question to ask, but I would say in terms of foods that help promote I can't say that. Peristalsis.
We know what we're talking.
Yeah. I think that the magnesium that I mentioned, because magnesium is involved in healthy muscle contractions, magnesium-rich foods, but also other minerals are helpful for muscle contractions, such as calcium and potassium. So I would suggest maybe just asking your physician to run labs on your calcium, potassium, magnesium, see where you stand, increase your dietary intakes of foods that are rich in calcium, potassium, and magnesium. And also, as I mentioned with the hydration, water is very important for muscle function. So just making sure that you're adequately hydrated. I think that those are kind of a good place to start. And then if you do have severe gastroparesis, I think that the best option for you would be to ask your physician to refer you to a registered dietitian. That way they can come up with a personalized meal plan to help you kind of treat the gastroparesis and the constipation.
Thank you. Sandy, somebody asked when they are evacuating their bowels, they're getting dizzy, or the tremors becoming a little more prominent. Any recommendations or advice to that?
Yeah, I saw that in there, and it kind of so I think again, I'm not seeing you or being able to direct specific treatment, but generally, when people are when the rectum, and I'm going to use my hands a lot, when the sigmoid colon and the rectum and the rest of the colon aren't working in an organized way to push the stool out, we attempt to tense the diaphragm to create a downward pressure and tense our abdominal muscles to create an inward pressure. And if we relax our pelvic floor at the same time, then that all should work, right? One coming down, one coming back. And if the pelvic floor relaxes, you're helping the rectum push the stool out. A lot of times people tense their abdominal muscles and pelvic floor muscles at the same time. And so then all you're doing is compressing your aorta and your vena cava, and you may be altering the blood flow to the head, right? And that's where the dizziness comes in. Maybe you're holding your breath with that. And in that scenario, I can see how the tremor would get worse. I think the things that Delana mentioned about, like what does is your stool hard? And that's why you're straining. And I did not show the Bristol stool chart, in which case you might need some softening. Or is the stool consistency really great? And on the Bristol stool chart, that would be a type 4 stool. So it's soft, maybe a little Play-Doh-like. And if your stool is a type 4 and you're still really needing to strain, that's where things like the massage, the timing of eating, the movement, and if someone is seeing me, I'm going to explore the tibial nerve stimulation because of that crossover of evidence. It works for constipation, and it works in people with Parkinson's disease who have urinary issues. Mm-hmm. I'm not going to wait for the specific study that says it works for constipation and Parkinson's disease before I offer it to a patient. And that's because in most conditions, and it is safe and it is low cost, and I like the safety and the cost are big influencers of how I will encourage someone to pursue care. Just like Jelena might not be saying like, use this specific probiotic that you can only get here. It's like eat something simple. So I hope that helped without taking too much away. Like I can't
Uh,
do it now.
what if you don't feel you have completely evacuated your bowels? Would you still recommend kind of the same thing you just described for somebody who's tensing too hard?
So the sensation that you haven't
Hmm.
completely emptied and the
Yeah.
reality that you haven't completely emptied can be two different things.
Okay.
Someone mentioned dysenergic defecation in there, which is analyzed with a study, and they can look at residual stool. I would not sit on the toilet more than 10 minutes. I would get up and move around and go on with your day. And I gave you very specific, easy exercises. But if you're engaged in another Parkinson's directed program, that has you moving more, go on and do that and just wait until later in the day. It is normal, not pathologic, to poop every other day or to poop 3 times in a day. If you're within that range, it's considered to be a normal bowel function.
Okay. So I'm going to open this question to the both of you. One, do you find that women who are going through their menstrual cycle, are they getting more constipated? And then are there exercises or nutrition that you recommend for women who are experience their menstrual cycles?
I'll be honest with you, I don't really work with that population very
Okay.
much. So there might be, but I just don't know enough about it personally. It's typically not the age demographic that I'm working with. So I don't think I could be a much help
Okay.
answering that question.
Yes, evidence does point to estrogen influencing bowel function. And so changes in estrogen will change bowel function. It will be very individually based. What I love so much about what Jelena presented about diet and food is it applies to so many populations, right? And people could benefit by eating in the way that she described. So it probably, you might, when you were younger, you might have had a buy, like everything worked perfectly when my hormonal levels and my movement were exact. And now, oh, it changed. And you might have to say, like, oh, you might have to put your ratio of fruit to ice cream might need to change as you get older.
Um, Sorry, I was busy reading the questions. I have a question about hydration. So you mentioned water. What about cheese? Because green tea is highly recommended because of the
Mhm.
antioxidant properties. Is that because of the caffeine? Is that beneficial or does that counteract what we're trying to do here?
I don't think it counteracts. So
Okay.
fluids don't have to just be water. We focus on water just because it is the preferred fluid, right? It's good for our health. It doesn't have added sugar or any other additives. So that's kind of what is emphasized. But fluids can be fruit juices, teas, even broth, like drinking broths or the broths that you would get in soup, or like I mentioned, some of the water rich fruits and vegetables like watermelon, lettuce, cucumber. I don't think there's really an issue with caffeine. I think that maybe just limiting the time that you consume caffeine so that it doesn't interfere with your sleep. But I think green tea is such a great um, beverage, because I think we've talked about this maybe in some of the past talks that I've done with you, is green tea is a really rich source of antioxidants, which is kind of like a topic for another discussion. But antioxidants are very, very beneficial for neurodegenerative conditions such as Parkinson's. So I'm a big proponent of drinking green tea.
Let's go back to the gastroparesis. You said that you have a little more
Yeah,
advice on that.
Yeah, I'm so sorry. Totally forgot to mention this, and it kind of just came to me as soon as we ended that question. But if you are having trouble with fiber digestion because you have a condition such as gastroparesis or some other type of GI condition that just makes digesting fiber really, really difficult, is there are ways to make it easier to digest. One of those ways is to cook your vegetables pretty well. So raw, uncooked vegetables are harder to digest than cooked vegetables. So, steaming your vegetables, cooking them in a soup, roasting them, the cooking process actually makes it easier to digest. Also, breaking down the food. So, either finely chopping it, putting it in a food processor, or blending it. So, if you have a hard time digesting fiber from fruits, if you make a smoothie, that process of breaking down the food into smaller molecules makes it easier to digest. So if you're wanting to still meet your fiber intake, but you're having a harder time digesting raw or undercooked fiber, such as what I mentioned, raw fruits and vegetables, then try cooking the vegetables and try blending and chopping up the fruits and the vegetables as well. So if you want to make a soup and puree it, that'll make it easier to digest as well. So that information might be helpful for those with gastroparesis who are still wanting to get enough fiber in.
Well, and that's also a great recommendation for people who have having swallowing issues. So, because that was a
Mm-hmm.
concern is if you have swallowing issues, consuming some of that
Oh,
these
yeah.
fibers. Hmm.
Yeah, I don't have an immersion blender. It's like one of those things I keep telling myself I need to buy, but that would be a really great thing to invest in to make like pureed or softer soups. And then, of course, investing in like a blender or food processor or some other kitchen tools that could help both for texture purposes if you had swallowing difficulties, but also maybe to help it be easier to digest all these fibrous foods.
All right. Well, we're coming up on the end. We do have one more question that came in about more teas. And do hibiscus or ginger teas help with digestion? We do, you see those, that marketing. Is it true?
Yeah. I know that ginger tea people get a lot of relief from like nausea. I don't know so much that it would help with constipation. It might. I just haven't looked into that. And then hibiscus, I'm not too sure how that helps with digestion, but I would say that any herbal teas, as long as they don't contraindicate any medications you're taking, there's nothing wrong with drinking those teas. Keep in mind, kind of like what I mentioned with supplements interacting with medications, herbal supplements specifically can really contraindicate with a lot of medications. And when I say contraindicate, it could affect the way that your body metabolizes a certain drug. It could affect the way the drug works and stays in your system. So if you think of herbal teas kind of the same way you would think about supplements, in that you just want to make sure that there's no contraindications with medications that you're taking. Aside from that, though, like hibiscus, ginger, green tea, black tea, they're all generally good for your health if there's no other contraindication associated with them.
Well, I want to thank you so much for this wonderful webinar because I think everybody got practical information, stuff that we can do at home when we are desperate to have a bowel movement. And I just think a lot of people are also sharing some great ideas, getting that blender and making those soft soups, having that tea, making sure we have our water bottles and drinking. And Sandy, you gave us a whole new set of exercises we all need to be doing.
Yeah. And
Uh,
I also do want to, I didn't mention it as much either, but I do want to just piggyback to what Sandy said about stress management. It was a topic that we really wanted to include because we also think it's such an important component of this. So just keep that in mind walking away from this presentation, and maybe just spend a little bit of your own time researching stress management techniques, because that is an extremely important component of this discussion that we're having.
Yeah, we actually coming up with the Brian Grant Foundation. We have a mindfulness-based
Oh,
stress reduction course starting, I believe, next
oh,
week. Highly
perfect.
recommend that
Great
one.
way to introduce it.
Well, everyone, Jelena, Sandy, thank you so much for joining us and for providing all this invaluable information. Everyone else out there, I hope I got to all your questions. I'm sorry if I didn't. I hope you all have a wonderful day. And so go out there, reduce your stress, eat high fiber, and practice those new exercises. Thank you and have a great day.
Bye.
Bye. Thank you.